My name is Dr. Yince Loh. I'm an interventional neuroradiologist and neurointensivist, and I work at Swedish. I'm an interventional neuroradiologist, which means I deal with neurosurgical and stroke procedures inside the blood vessels of the brain. I actually like to approach each person and their problems individually. There's no two aneurysms or two vascular malformations that are the same. Same way, there's no two patients that are the same, and I want to integrate the patient's request, the patient's desire, what they're looking for, as well as much science and scientific knowledge that we have to integrate to advise the patient for the right course. I think that the cerebrovascular team at Swedish is a very well-rounded, multidisciplinary team, and that's not something that you can get from a lot of other centers. The benefit to the patient is that they're going to be offered all options, and they can pick and choose the option based on which one has a better risk-to-benefit ratio. We try to be as cutting edge as we can. We are participating in many multi-center trials, so we're advancing the techniques. And by participating in these kinds of clinical trials, we're actually bringing in the more complicated patients, and we're seeing the more complicated diseases, and we're at the same time learning and being able to treat more and more difficult things that we wouldn't be able to treat 20 years ago. At the end of the day, I absolutely find my work fulfilling. I have patients that come up to me, and I treated them years before, and they remember my name, and they remember that I remove the clot, and the amount of impact I have over their lifelong existence is something that's immeasurable, and that brings a lot of satisfaction to me.